I work at Lake Charles Memorial Hospital. I'm a part of our sports medicine program. I work with our orthopedic surgeons, our physical therapists, other general medicine doctors that are part of our sports medicine team, often at sidelines for high school football games with physicals, and I really enjoy that aspect, that hands-on part of this job. I've been at Lake Charles Memorial for 3 years. I practice 100% pain management, although I'm an anesthesiologist, haven't put someone to sleep in 3 years, but that background really helps a lot seeing injured players, knowing ACLS, airway management. So it's a skill I hope I never have to use again, but it is a very valuable skill. It's reassuring to see EMS on the sidelines as well. But sports injuries is a team management. It's good that I was able to follow Jamie's presentation with the awareness and having a plan for a severe event. I want to talk to you about spinal injuries, traumatic brain injuries, spinal cord injuries. Unlike the presentation you just heard, a natural disaster or any terror-related event is something we hope we never encounter, but it's something we always have to be prepared for. What I'm going to talk about is something, unfortunately, you will encounter. And unfortunately, it's a very serious, potential devastating injury. Spinal cord injuries, of course, you know, paralysis, and traumatic brain injuries, concussions. Here's just some brief outlines. We're going to talk about traumatic brain injury. How has that changed? The definition of concussion, how to recognize it. There's been quite a big paradigm shift recently in how you recognize it and how we treat it. Most of us think of a concussion as someone who's knocked out. We think of the boxer in the ring who's KO'd or ultimate fighting, someone that's down. But that's an extreme example. But you can still have a traumatic brain injury and not even realize it. And so you have to pick up on small signs and symptoms, because the risk of having a second traumatic brain injury or a second microconcussion on the first can be devastating, can lead to death, or even potential long-term consequences. We'll talk about the long-term consequences, the immediate aftermath. We're going to also talk about the coach's responsibility, the trainer's responsibility, healthcare professionals' responsibility, the school administration's responsibility, some of the healthcare laws. All 50 states have rules in place for education and training of the coaching staff for recognition and prevention of concussions. You need to know that. We're going to go over that, and I'm going to provide a bunch of educational resources that you can have to be certified and up to date and in compliance. We want to just also talk briefly about some of the chronic pain, musculoskeletal symptoms that we may see. This is more what I do on a day-to-day basis, see patients with neck pain or back pain. We try to manage that as conservatively as we can, but spinal musculoskeletal injuries can be debilitating. It's one of the leading causes of patients going to a doctor every year is some sort of musculoskeletal pain. How do we manage it? How do we treat it? What can you do yourself to prevent and actually rehab yourself? And then as far as on the field, how do we prevent further injuries? It's all about a culture of safety. Louisiana has, one point, had the highest rate of cervical spinal cord injuries. You think about the Saints, the trouble they got in with their bounty. So Louisiana, the South in general, has a very poor reputation for a culture of injury and just awareness of an injury in general. So especially it starts at the youth athletes. We need to have a culture of safety and discourage the desire to hurt other players. This is what we typically think of a concussion. Someone's knocked out. Okay, well, this is easy to recognize. I wouldn't be here talking, y'all, if that's all it was. But as I'm going to go through this talk, we're going to talk about several signs and symptoms, mostly cognitive, but there's other things we need to pick up on. It's not as easy as a 5-minute on the sideline. Hey, do you remember the last play? Do you know what your name is? It's actually a multitude of questions and evaluations, and if there's any suspicion, you want to take it to the next step, involve a healthcare professional or even a well-trained coach or staff can go through a litany of questions and evaluations to be sure that that player is protected and prevent it from further injury and return to play. So again, I think a really introduction, we're going to talk about the what our state says, what the mandates and responsibilities for the coaches and healthcare professionals for evaluating, treating, and returning a player back to a game who has a suspected concussion. Recognition, I'm going to go through a bunch of signs, symptoms. We're going to look at what the CDC, Center for Disease Control, what they say, the literature that they provide in layman's terms about how to recognize signs of concussions. Evaluation on the field, and even further than that, what's the next step? Okay, you've recognized very subtle signs of concussions. What would you expect your healthcare provider to do? You hope that you bring your player, your child, your family to a healthcare provider that's going to be aware of all these new findings and treatment plan, but you need to have an expectation of what the next step would be. Is it a CT scan? Is it further evaluation? When can they return to play? The teachers, the parents, everyone needs to be involved. So you need to be a little bit educated on what your healthcare provider responsibilities are as well. Return to play. There's guidelines on when a player can return. That's part of your healthcare provider's responsibility. But we even have to address, can an athlete ever return to play? That's a very tough and difficult situation to find yourself in. American College of Neurosurgery has some guidelines on if a player should ever return to contact sport. You might have to introduce them to chess or other debate or other non-contact sports, but it'd be better than suffering some of the severe long-term neurological consequences. Can I take this off? Okay. Perfect. I'm not tied behind a podium. Okay, so what is a concussion? It's defined as a mild traumatic brain injury. Most of us think of that as swelling or a bleed, a clot in the brain, a skull fracture. Well, that can be part of a concussion, but we're realizing it's more on a neurophysiological basis. It's a lot of biochemistry terms, which I don't really want to get bogged down in the details, but I have one interesting slide we can go over, and I'll wake you up when that's done. Neuroimaging. Again, not every concussion is knocked out. As a player who's knocked out, not every concussion will you find any findings on a CT scan. There's more advanced imaging, a PET scan where it's become very fancy, but they're very expensive tests you can do. It's not practical, but it does help in research and understanding of concussion, that it's more on a neurophysiological basis, a biochemical basis. May not involve a loss of consciousness. There's multiple symptoms like I already discussed, and we'll go into detail. You may not recognize the concussion right then. It may be a few days later. Even if you recognize it then, it may seem to resolve very shortly, but it's something that needs to be monitored for a few days, weeks, months, something that everyone needs to be aware of. It's not one person, a coach or a trainer, that needs to recognize that, oh, this player had a concussion, because it may be subtle personality changes. It might be grades. It might be social interactions. A good example, which we're seeing more in the news, is our veterans returning home from the wars. A lot of these soldiers are suffering these roadside injuries, these concussion injuries. There's no direct physical signs of injury, but the blast itself has had a significant impact on the brain microstructure, and they're developing a lot of cognitive and emotional and personal adaptation skill problems. These are signs of chronic concussions, which can happen in young athletes as well. So concussions are the second leading cause of traumatic brain injury besides motor vehicle injuries. Approximately about 300,000 concussions per year in youth athletes. And that's probably on a very conservative side. It is something you will see. Hopefully you will never see a natural weather disaster or a terror-related, but this is something you will see. And again, I just want to emphasize, it can have long-term consequences, but recognition and treatment is the safest way of preventing further neurological consequences. So just look down a breakdown. I'm just going to keep harping on football because, of course, it's the leading cause of concussion injuries, but it's not to forget that other sports too, soccer, lacrosse, wrestling. We don't have a lot of ice hockey here, I don't think, but some areas, Lafayette, have these indoor ice rinks, and so. But soccer is a big sport around here, and it's something that I don't have any immediate data, but a lot of people are questioning headbutting the ball. Okay, it is the part of soccer. Understand, I played soccer, I played football. The ball is kicked 500 feet in the air. You just have to headbutt it. It's a strategic advantage to do that, but it hurts. It really does. And I've always wondered in the back of my mind, what am I doing to my brain? And it is something, hopefully we'll have some more information soon. But soccer is definitely a big sport around here, and concussions are very high. So this is just a slide of the major injuries, the macro structures, so to speak, from a concussion. There can be blood vessel injury. There could be disruption of the blood-brain barrier, the lining around the brain. You might see a blood clot, epidural hematoma. Okay, these are obvious signs and symptoms you can see most of the time on a CT scan. But again, remember, not all concussions can be diagnosed with imaging. So this is the boring slide I was talking about. This is what causes concussion. Try to put it pretty basic, but this is a brain cell. Okay, these are things that you lose whenever you have a beer or jump on the trampoline, okay? But fortunately, we have millions and millions of these, so we have brain cells that we probably don't even need. But on a small scale structure, I'm going to summarize it. These are small little ions, potassium, sodium. What happens when you have a concussion is these little ions leak. There's just a bunch of leaked cells. They go out, they come in, the cell membrane is disrupted, and they like to have a certain number inside. And if that number is disrupted, all hell breaks loose. But fortunately, the body is designed to have a very sophisticated system of correcting that balance. Okay, these cells are pumped in, these ions are pumped in, the good ones are pumped, bad ones are pumped out, the good ones are pumped in, but it takes energy. It can be corrected, it just takes a little time and energy. But it's working overdrive when a major concussion happens. So this cycle goes on, it's working to correct itself, it takes time. All the while, you're burning up a lot of energy. At some point, you're going to run out of a little bit of that energy. It might take a little time to replace. Fortunately, we have an anaerobic cycle that is a little more efficient. It has a little more energy. It kicks in and it starts creating more energy. So, example, long-term runners have very good anabolic systems to create energy and endurance. The problem is some of these ions that leak in stop that anaerobic cycle, and so energy is lost. Other things that leak out is these neurotransmitters or we call neuroexcitatory transmitters. Basically, they just arouse the brain, okay? Arouse the brain, more energy. So it's a death spiral. It's okay. Again, our bodies are wonderfully designed and made to compensate for these injuries, but it's the second injury that occurs. You cannot recover. And with youth athletes, they recover a lot worse than adults. I'm not sure we understand completely why, but there's some, I think it has a lot to do with the brain is still developing. It's one of the last organs in the body to fully develop, but not fully understood. But youth athletes do not recover as well as NFL players or a boxer will. So this is why there's laws to prevent, number one, because kids can't really make their own decisions, and number two, they're more susceptible. So this is second incident syndrome, kind of what I talked on, briefly mentioned. What happens after that second incident occurs, these little small charged particles are not able to correct themselves, and they're in the cell, and what happens is a lot of water follows these charged particles, and the brain swells. And so now you start seeing CT scans and neuroimaging of brain swelling, and the brain does not have a lot of room to go, and so it doesn't have any room to go, and there's pressure. It can cause traumatic brain injury. It could occur immediately, could occur within a few weeks after the second concussion. Again, the second concussion, it's done, it's over, the bodies give up, I can't go anymore, there's no other reserves, and then you have major neurological consequences. Again, occurs most often in children and adolescents. And with the second concussion, it can occur within 5 minutes. Remember, the first one, you can see signs and symptoms for weeks and months. The second one, you can have death within 5 minutes. We always hear in the news of this athlete that dies suddenly. Well, a lot of it can be congenital heart conditions, a prolonged QT, or different structural problems with the heart. That's common, or different genetic conditions. But oftentimes I wonder if a good autopsy would have been done, would there be a second concussion when you find signs of brain injury? Okay, now that's the immediate severe aftermath. We're becoming a little more familiar with the long-term consequences with our vets coming home from war. Muhammad Ali passing away in the news. We all know he had Alzheimer's, but some of these symptoms long-term, especially with the NFL players, the recognizing early onset dementia and Alzheimer's from the repeated concussions. Dementia, Alzheimer's, and then you have a lot of personality changes, interpersonality dysfunction, cognitive abilities, poor school performances, difficulty remembering. That on top of high school kids are smoking marijuana, I mean, will their chances of college education go down, okay? Okay, so what is our state? Currently, I believe all 50 states have some sort of government regulation. So what does our state say? Pretty much all of them are the same as far as I could tell. Didn't have a chance to research all 50, but they seem pretty similar. Well, number one is 3 steps, and we'll break it down. One is the responsibility of the school, the coaches, to provide information. You go to the CDC websites, there's brochures, print them out. Here, parents, here, coaches, this is how you recognize a concussion. This is what you do if you recognize it. The second thing is some sort of training. Again, I think the CDC has the best website. You go online, you don't have to pay, you watch a video. I don't know how long it takes, but it might be an hour video, but you can print out a certificate and, hey, I'm trained, I'm in compliance. And lastly, the parents or the guardians have to sign some sort of paper that says, I was educated, I'm aware of risk from concussions and recognition and how to recognize. Now, these little brochures are easy, of course, we have a mandate, but fortunately it's easy, it's free. You go to the website and you download these brochures. Here coaches, here staff, here parents. Pretty layman language. Of course you can't read it, but I have some slides that go in detail. I just want to show y'all that there's free resources out there. All you have to do is print it, hand it out, post it in a locker room or a coach's room, or just distribute them somehow. Okay, the first aspect for the Louisiana Youth Concussion Act is each coach, whether it's a paid, a salaried coach or a volunteer, has to complete an annual concussion recognition education course. There's several out there. Some of them you have to pay. I guess there's courses you could go to, but the easiest, quickest, cheapest, go to the CDC website, watch the video, get your certificate, you're in compliance. This is part of the actual legislative bill. You see the 3 components, which I already mentioned, but I'm sorry, this is one step back. This is the course, the requirements of the course for coaches, volunteer or paid coaches. What sort of course you have to show compliance. The course has to teach how you recognize the signs and symptoms of a concussion, the necessity of obtaining proper medical attention, and the nature and risk of a concussion. Pretty much stuff I said already, but I'm going to briefly go over them again. This is just the link to this video. You go, you hit play, you go through these modules, and you print out your certificate. And lastly, the legal guardian must have some information sheet. And I'm not sure, it does say, sign a concussion and head injury information sheet of requirements prior to a youth returning to play. So this is where the parents have to get involved, because it's not something you're going to pick up right on the field. It's not that, I can't remember last play, or I can't remember my name or date, or they're talking about some ridiculous stuff. I've seen it on the sidelines. It's pretty bizarre stuff players will talk about, but it's not always that obvious. So more than just a 5-minute evaluation, if you recognize any of the subtle sign of symptoms, you have to let the parents and coach know, hey, if you recognize behavior problems, concentration difficulty, sleep difficulty, you need to report it. We need to go to the next treatment plan. And that would involve getting a healthcare professional on board. Responsibilities of the coaches. Okay, these are the signs that the staff needs to be aware of. Dazed, stunned, confused, forgetting assignments, positions, instructions, unsure of the game, the score. They move clumsy, they answer slowly, lose consciousness, even brief, mood, behavior, personality, can't recall events prior or can't recall events after. So any one of these signs or symptoms, stop right there, take the player out, get a healthcare professional involved. We kind of went over what the coaching and the staff should be aware of. The players need to be aware of these symptoms because these are symptoms only the player can tell you or may recognize. Just nausea, headache, dizziness, sensitivity to light, noise, just not feeling right, concentration, memory problems. So more subjective things that may not be reported or recognized, but if the athlete is aware of these, they can hopefully report it. So what's the responsibility again for the coaches? Number one, educate. And number two, remove the athlete from play, have the athlete evaluate it, inform the parents, the guardians, just keep them out of play. That's the biggest, most important. Do not let the player go back, no matter what the score, no matter how big the game is, consequences or death, period. Okay, and beyond that, beyond recognition and removing out of the play and getting the healthcare professional involved, again, it goes back to the culture of safety. Padding around the goalpost, behind the basketball goal, any bleacher or any object around a little table too close to the field or the basketball court, you want to move those just to prevent any head injury. A good example, football coaches going over the games. Okay, look, I'm seeing some risk factors for concussion. Johnny likes to duck his head a little bit, or maybe they're spearing, or just they're using their head to tackle. That's probably the biggest risk factor, is using the head as a weapon to take a player down. We're going to kind of compare the rugby model, what they do. Is it any better? There's some evidence. Nothing's perfect, okay? That's the problem. Nothing's perfect. The padding, the equipment, the mouth guard, the helmet. There's no foolproof method or equipment that will prevent a concussion. Again, recognition, taking the player out of the game, but there are some common sense things that we think theoretically might make a difference. And yes, it happens. The Saints brought this to light. $1,000 for courting off a player, or $1,500 for a knockout. Okay, I was a little less sympathetic to the NFL players. They do this for a living, okay? They're not kids. They've grown ups. They can make their own decisions. Okay, but that's the NFL. I'll let them take care of it. Our responsibility are for our kids, and these are their role models. So this is what we take from this. Not so much I care about I do care, but it's not like it's our responsibility is not for NFL players. They make their own decisions, but these are our role models. So you can very easily see the same model repeated in youth sports. Okay, so the healthcare professionals, and how am I doing on time? But okay. Okay. For healthcare professionals, you need to know going in when you consult a healthcare professionals, what are they going to do? What are your expectations? Okay, for the physical exam, the healthcare professional should screen for risk factors. Depression, ADHD, any psychological risk factors, history of migraines. These at least should be recognized and not exclude the player, but know that that player has a risk factor, and have the trainers involved and just be a little more cautious, but at least recognize risk factors by history. Prior concussions is probably the biggest risk factor. Have you ever had a concussion before? Okay, we're going to keep a close eye on you. This is just a form for the healthcare professionals. Headaches, developmental history, learning problems, ADHD. We kind of went psychological history, anxiety, depression, sleeping problems, prior concussion history. When was the last concussion? Okay, so there's risk factors that need to be identified, starting with a physical. So when is it a medical emergency? Well, here's the red flags. Basically, any neurological signs or symptoms, sensory sensory deficits, motor deficits, weakness, numbness, visual changes, nausea, vomiting, get a CT scan, rule out any major structural neurological injuries. But any clinical signs other than just cognitive, CT scan, get them a healthcare professional and evaluate it in the emergency department. Okay, there's this ACE, the CDC talks about this ACE care plan. I'm not going to go into too much detail, I'll try not to, but basically, if it's not a medical emergency, but you do recognize signs or symptoms, forgetting the last play, cognitive difficulties, you're not going to return them to play immediately. You're going to go through steps. It may be neuropsychological testing, the things that the tests that the plant workers take. It take 8 hours to take an exam. Not that extensive, but very long test that asks ridiculous questions. That's a neuropsychological test, but picks up subtle signs of cognitive changes. 3 or more concussions. This is what a judgment call is. A player has had 3 documented concussions, probably should just take him out of that sport from contact sports, period. It's a judgment call. Understand the parents, the player needs to be involved, but there's 3 times the risk of a repeat concussion and neurological injury. This is for the healthcare professionals. It's a form they fill out. You go to CDC, you can print it out, but it pretty much documents returning to daily activities. The first step, okay? Don't go to school. You're just going to go at home, have, video games, very minimal video games, very little cognitive stimulation, but just stop everything. Don't even return them to school. Start with the basics. Getting up, dressing, very minimal, avoid a lot of TV, video games, just give them a book to read, period, okay? If they do well with that, go to the next step. Returning to school, okay, they're okay at home, you return to school, half the schoolwork, half the activities. This is a high school student's dream, okay? No homework. This is what a healthcare professional says, no homework, no tests, nothing, and they have the right to do that. But they can limit half the assignments, but they really get a free pass here. Lots of rest. When they're first at home, let them take naps, limit physical stimulative activities, video games, TV, limit physical activities. Again, limit hours at school, homework assignments, tests, strenuous mental and physical assignments. Okay, you're going to return to play. There's 5 steps. Each of these steps should take no less than 24 hours. So you pass step 1, they're okay at home, they're okay at school. Okay, you're at least looking at 5 days before they go back to return to play. They have to go through each of these physical exercises, and if there's no symptoms, return to play. Healthcare professionals can go on the CDC, download this ACE form, pretty much everything I went over, but it's a little checkoff list. Prevention, equipment, theoretically, your proper helmets, gear. It does protect against a skull fracture, major injury. It's debatable, will a good fitting helmet even protect a concussion? But the most important thing, just remove from play. The most important thing, this has been shown to prevent further injury. Louisiana does not have a good reputation for spinal injuries, concussion injuries. You look at the 90s, Louisiana Medical Society had a publication. We had the highest rates in the nation of cervical spine injuries in high school football. 1989, 4 high school players sustained pretty much paralyzing spinal cord injuries, most common in linemen and defensive players. Prevention, American neurosurgical societies recommend, neck exercises, back exercises, strengthening. About 10 to 15% of linemen, defensive backs have some sort of small lumbar spinal injuries, a spondylolisthesis. It's a big term. I have a slide that describes that, but it's not a debilitating injury. The players can still play. They have to have good education in muscle strengthening and core muscle tones and know how to move their back, and their posture becomes a lot more important for these players. But small spinal injuries can still, they can still play and do well if it's recognized and addressed. Tackling, the heads up, the Hawks, Seattle Hawks had devised, they have some video or method of preventing head contact, whether that even works or not, but theoretically it sounds good. I can briefly go over that. And this is their method. Head up, face mask up, put the head to the side so you're tackling with your shoulders. And on the counter argument, well, does that, just by that method, does that put your head in a different position that may make it, okay, you're not tackling with your head, that's good, but is it foolproof? No, but at least the take-home message is not tackling with the head. You're tackling with the shoulders. Now, going over some chronic spinal injuries, this is we call a bulging disc. This may not even be painful, but oftentimes can be. This is the annulus tear, a little white dot. You see that, the patient complains of pain. They probably do have pain, but returning to play, even athletes, I've seen, several recent athletes who have some disc bulging and back pain. Something you hope never to see until you're like old man, 40s, 50s, 60s, 70s, but it can happen even in young athletes. They can do well, they can recover, but more education, their posture, how they move, how they sit, how they stand from a sitting position. These things are the most important. You use your muscles to guard your back to prevent stress on the lower lumbar spine. They can do okay, they can heal. Return to play. If I see this, they come, we're going to talk about return to play when they're asymptomatic. This typically takes about 6 weeks to heal, to get better, but it could take weeks, months, years, so you don't want to return to a contact sport until they're symptomatic at rest. This is the spondylolisthesis, common in gymnastics, arching the back, rule 4, fracture. We call this the pars interarticularis. It's part of the posterior structure of the spine, and when this fractures, this occurs. You can use your muscles to brace. This probably hurts, okay? This is probably almost between a grade 1, grade 2, but there's, it's common to have more subtle findings of this. As far as trainers see on the sidelines, when a player complains of back pain, you want to feel their back, look, see if you actually feel a step off. If you can feel any notch or indentation, stop, time out, get them evaluated. They may have had suffered a fracture here, which can slip even further and cause major neurological injury. But it's not uncommon to see this in 10 to 15% of defensive linemen, which are asymptomatic most of the time, but not to this degree. Again, you want to work in your muscles. Okay, you go to a doctor's office, he says you got back pain, or you turn on the TV, you see a commercial for, do you have Medicare? Yeah, we can get you a back brace. Okay, well, or a knee brace. You don't need a knee brace or a back brace all the time. Use your muscles to do what that brace does for you. And it's more just strengthening and having a big tone core and six-pack. You don't have to have a six-pack. It's more of telling your mind when to strengthen these muscles whenever you're standing, sitting, standing or moving. You want to brace yourself at the right time. So you don't have to always go around tightening your six-pack. It's just you do it whenever your back's about to move. Okay, the last part is just chronic spinal injuries. There is an opioid epidemic in this country. It's the second leading cause of accidental death in America. You turn on the TV, you read about hydrocodone and all these medications. It's horrible. We need to start at the youth. They may have a major injury, a major fracture. You want to talk with your doctor, how much pain medicines are they going to use, who's going to be in control of this, how can I limit. You go to Europe, they hardly ever use any opioid pain medications. I'm not saying that's where we need to be, because I think they have other problems. Personally, I think they have other problems with our healthcare system, but there are some learning points. Do we use too much opioids? The answer is probably yes. So we can limit, and 12% of male athletes report using opioid painkillers. Who's at risk? White, male football players. Okay, so the more contact sports. I hate keep harping on football, but let's face it. It is the sport that is the highest contact, highest risk of injury. Okay, great, they recovered, they've been through the process, they've seen Dr. Cassio, they got better, but they had some pain medications from post-op day one and they like it, and you want to recognize, are they trying to get it from their friends, going to other friends' houses and stealing the medications? And so that's conclusion of my slide. Educate staff, parents, players, remove the athlete if you suspect a concussion injury. It can lead to chronic death or even chronic long-term consequences. Opioid pain medications are commonly abused in youth athletes. Thank you very much.